Good evening, parents. Hearty welcome to the workshop hosted by Little Dentist, where we'll help parents in taking care of their children's dental hygiene. Today, we have Dr. Kavita Siroy with us. She's an MDS pedodontist who has more than 13 years of experience. She has worked with various dental clinics and she has also worked with Max Hospital. And she has been attached to Little Dentist for the past 3 years. Good evening, doctor.
Good evening.
Topic for today's workshop will be brushing in children, and oral care tips. Doctor, what are your views on this?
Yes, so when it comes to brushing or maintaining oral hygiene in children, it is a very big nightmare for the parents because most of the parents who come to me, they have a question or they are more worried that their child doesn't allow brushing. He is so fussy, irritable, crying. He doesn't like the flavor. So many queries are there. So in this video, I would like to address all the realistic problems rather than going on to the technicalities. So see, brushing don't build up a pressure on you that obviously everybody knows, and this is everywhere told that 2 times brushing is very important. Yes, 2 times brushing your teeth is very important. But in case of children, we have to find out ways to engage them because in the small age group, it is very difficult to make them brush. They will once you want to brush their teeth, they'll run here, they'll run there. So in this case, we need to find out the ways in which we can engage them to maintain a good oral hygiene. Now, how can we do that? So brushing is important. So maybe what you can do is, one of the method is that you can start brushing with the child along. You can the time when you are brushing yourself your teeth, make the child do that because most of the kids they try to imitate the parents. So when they see you brushing, maybe they will also like to do that. Then sometimes in small age groups like less than 6 years or 6 years of age, mostly the brushing it should be supervised or aided by the parents. So what you can do is, because at this age group the kids they want to do it themselves. So but because they are doing it themselves and because of the age, they are not very much capable of doing it properly. So they are brushing, but maybe the technique is not right and they will not be doing it the way it has to be done. So what you can do is let them do, but at the end you tell them, okay, let me check how well you have done, if any bug or any monster is hiding, and then you can take over and brush all the teeth. So how are you going to brush? Use a soft bristle brush with a fluoride toothpaste or a non-fluoride toothpaste in those children who don't know how to spit and they will be swallowing the toothpaste. So in that case, how the parents have to do is that you have to brush the teeth gently in all the surfaces, front, surface, back, on top, and make them rinse after the brushing. Okay, so now this was the part about the brushing. So if you are able to do it 2 times, maybe in the morning and night, it is very good. But if in case you are not able to do it twice, like sometimes, the kids, when they are rushing to the school, they don't want to brush, they are in rush. So it's okay. If even if you are brushing once in a day, it is also good, but then the brushing has to be done properly. That means that make sure you are brushing all the surfaces. Don't build a pressure on yourself that the child, don't force the child that you have to do, but just even if once it is done, it should be done properly. The other method apart from brushing the teeth is to clean the tongue also. How you can do the tongue cleaning? In that case, you can use a soft damp cloth or you can also use a soft bristle brush. So gently in circular motion, just rub it around the tongue and rinse after the cleaning. So the cleaning of tongue is also very important because that also maintains a good oral hygiene. Now, next is, apart from this, you can also engage them in some fun activities. Like if if sometimes the parents are asking, ki, should I use a electric toothbrush? Maybe because my child is not brushing well. So can I go for an electric toothbrush? See, any toothbrush is good until unless your child is not brushing, nothing is good. So if your child is comfortable with the manual brush, that is also good. If you feel ki, yes, the child is not brushing, so maybe you can try new ways, get an electric toothbrush, because that will be like another fascination for the child, or maybe they'll feel it like a play activity because it has got vibration, the head is moving. So maybe because of that, they can get interest in brushing. So that is also one way. So in that case, use anything which the child is comfortable. If they are comfortable with the manual brush, you can go for that also. Otherwise, electric toothbrush also is equally good. Then another thing is, apart from brushing, another thing which makes a very important role, which plays a very important role in maintaining hygiene in children, is rinsing. Now, see, because the kids are so fussy about brushing part, and also it is not possible for the children to, brush every time, because the diet pattern of children is such that they eat food which is mostly sweet in nature, or even if they are eating, they eat in short breaks. Like the snacking time is more, the frequency of snacking is more in children. So every time they eat, food is going to be there in the mouth, and it can be a cause for dental cavities. So the best oral hygiene measure apart from brushing is to teach your children rinsing, how to rinse. So rinsing is very important, that after every meal, it's not necessary that it is something sugary item they are having. Even the normal meals, make sure after that they can drink few sips of water, or they can also, if they know how to rinse, they can just rinse with normal water. So that will also help in maintaining a good oral hygiene, good oral care, because the food will be clear and less chances of bacterial formation will be there. Then like if in small age group, like 2 years, 3 years, sometimes maintaining brushing is again not possible. Even they don't know how to rinse. So in those kids, you can give them few sips of water to drink, so that most of the food will get cleared. And also one more thing which you can do is, whenever they are eating, after eating, just take a wet clean cloth, soft cloth, wrap it around your finger, and then wipe the tongue, wipe all the surface of teeth. So that is also a way of maintaining hygiene. See, we don't have to, be in pressure that my child is not brushing, or only brushing or rinsing is the proper way. We have to find out other ways according to the kids age also. So even if we are able to clean every time with the help of a cloth also, then that is also a part of maintaining a good oral care, because we are cleaning the teeth, the food is getting cleared. So all these things. And yes, I would also tell about the infants. So like for infants, when there are no teeth, at that time you can clean with again you should clean the gum pads with the help of a soft wet cloth. And once the teeth start erupting by the age of 6 months, you can use a finger brush or a soft bristle toothbrush in the children. So that is how we should maintain good oral hygiene or good oral care for children. So don't build up pressure. Just make sure that you have to clean in any way. You have to find out ways. You have to engage them in certain play activities. And sometimes if you are brushing for the children, most of the parents, what mistake they do is, like, they stand in front of the child and then they start brushing. So in that case, obviously your dexterity will not be very good. Why? Because when you are standing in front of the child, so the child will move his head here and there, he will run away, you won't be able to hold him properly. So the correct way is to stand behind, make your child stand facing the mirror. You stand behind the child, hold the chin like this from behind, and from back side you bring your hand and brush. So in that case, you will be having a better control. You can in a better way, you can hold the chin, and less chances will be there that the child will shake or move. So that is one of the thing. Another thing, like for making fun activity, what you can do is you can buy some timers, toothbrushing timers. Maybe you can tell them, see, this is stand timers are available in the market. So you can use them also. You see, this we are not doing something which is it's a difficult thing to do. What we are doing, we are going to play a game. See, this is the sand. Till this sand doesn't come down, we will brush. So maybe you can also do it along with them. So we have to find out certain ways, some play activities, we have to innovate with children, because there is no technical method in which we can make our child or our kids do the brushing. So we have to find out our ways, and each and every child will have a different way. So I know it's a tough time, it's a difficult thing for the parents, but yes, you have to find out all these things. So don't take too much pressure. Only these small steps can lead to a good oral care in your child. Last and most important is that schedule a dental visit with your pediatric dentist. Why? Because they can guide you if your child is started with developing some tooth decay. Then apart from tooth decay, they can also guide you in terms of any preventive measures, like even if there is no cavity, nothing is there, still they can tell you about maintaining those teeth in the same state. Like if your child has healthy mouth, so how you can maintain by doing certain preventive measures like fluoride applications, and also dental sealants, preventive sealants for children according to age. So they can guide you on all these things. So all these things if you are doing, so then I'm sure you will be able to maintain a good healthy mouth for your child.
Thanks a lot, doctor. Thanks for all the information that you have provided us. It was a very informative session. Thank you. Thanks a lot, doctor. Thank you.